it's Friday, August 14th, so it must be time for another legislative update from your North Carolina Medical Society. And first, I have some exciting news. If you're an independent practice, you can receive free personal protection equipment from the appropriation that the North Carolina Medical Society was given from the North Carolina General Assembly. All of that information is available on our website. So if you haven't seen it yet, we send it in morning rounds. We send a dedicated email. But if you haven't seen it yet, all of that information is available on our website. So if you're an independent practice, be sure to check that out. If you're not, we do have some of the other entities listed that did receive funding from the General Assembly for appropriations for PPE as well. Next, we had another busy week with joint legislative oversight committees this week, both in Health and Human Services and on Medicaid. Now, with the Health and Human Services Committee, it really focused on COVID-19 numbers and where COVID-19 funding that has been brought down by the federal government and appropriated by the General Assembly, where that has been spent. So legislators got a deep dive overview into kind of the finances of where we are with COVID-19. There's more information and kind of a breakdown on the numbers that were discussed on our legislative blog. We have a summary of the whole committee, so be sure to check that out if you're interested in looking more deeply into some of those numbers. Now, I also want to point out we had a North Carolina Medical Society member, Dr. David Hill, a pediatrician, present to the committee about how coronavirus is impacting kids and what we can kind of expect or what we need to look into moving forward. So thank you to Dr. Hill for presenting to the Legislative Oversight Committee. I think it's always great when we can have our members talk about this health data directly to legislators. Next, I want to talk about the Medicaid committee that also met on the same day in the afternoon. And this really focused on also the financial numbers of the Medicaid program and the move to transformation, where we've kind of seen numbers grow in terms of number of patients post-pandemic and where we think those growth areas will be in terms of categories in the Medicaid and NC Health Choice program. There were a lot of great graphics that broke down some of these numbers, and those slides are available on our legislative blog. So if you want to look more deeply into the numbers, be sure to check out our legislative summary on this committee meeting. But kind of the main theme that I want to point out to you is that the go live date is still set for July 1, 2021. So if you haven't already, be sure that you or your practice manager is connecting with the managed care entities to talk about your contracts, to make sure you're getting those set up before we get into this go live situation, that you're thinking about that. I know we're in the middle of a pandemic, so that kind of seems like a long way away, but it will be here before you know it. And another reason I'm pointing this out to you is that you are complimented by the Department of Health and Human Services by North Carolina having one of the highest Medicaid physician participation rates in the country. They were asked by some legislators on, do we think moving to managed care is going to have some access issues for patients, or are providers going to drop off in terms of participation rates? But it was discussed that North Carolina has one of the highest Medicaid participation rates for physicians in the country. So we want to keep that participation rate high. So make sure that you are looking into your contract as we move to this Medicaid managed care transformation. Also want to point out to you that we had a great Durham Orange County Medical Society meeting this week with legislators from Durham and Orange County. We almost had the entire Durham and Orange delegation participating. It was a really great kind of town hall discussion between the members of the Durham Orange County Medical Society and those legislators. So if you're a part of a county medical society that would love to have your legislators come in and talk to you, or if your practice would like to have a meeting with legislators, let us know. That's something that we'd be happy to set you up with. It's also a great time to do that since we're going into election season. Legislators and candidates want to hear from their constituents about issues they have, what ideas they have for legislation moving forward. So now it's a great time to connect with them. That's all I have for you this week. It was kind of a busy week, a lot to talk to you about, but I look forward to talking to you next week, and I hope you have a great weekend.